Good morning and welcome to the Thursday, March 18th, 2021 meeting of the Education and Finance Committee. Remote hearings are held in accordance with House Rule 10.01. This rule has been posted online and is linked to in our public meeting notice on the House website. All remote hearings will be recorded and live streamed by House Public Information Services. Members have the contents of their virtual packets available to them, and for the public, these same materials have been posted online. Members, if you're looking for all of these items in one place, they're attached in the calendar event that you have that Ms. Burt sent for today. To get on the list to be recognized by the chair, members using the Zoom interface have the ability to raise their hand via the app. Ms. Burt will place your name on the list to be recognized. Ms. Sunderland, would you please call the roll?
Chair Dabney.
Present.
Vice Chair Sandsted.
Present.
Representative Kresha. Representative Kresha. Representative Bennett.
Present.
Representative Daniels.
Present.
Representative Damath.
Present.
Representative Drazkowski.
Present.
Representative Erickson.
Present.
Representative Feist.
Present.
Representative Jordan.
Present.
Representative Marquardt.
Present.
Representative Mueller.
Present.
Representative Richardson.
Present.
Representative Thompson. Representative Thompson. Representative Wolgamott.
Wolgamott, present.
Representative Zhang.
Present.
Representative Joachim.
Present.
And that is the roll. We do have a quorum.
Thank you very much, Ms. Sunderland. Chair Marquardt, have you had the opportunity to review the minutes from Wednesday, March 17th? And if so, would you like to move approval?
Mr. Chair, I will move approval of those minutes.
Thank you very much. Any discussion, members, to the Marquardt motion? Hearing none. All those in favor of the Marquardt motion to approve the minutes from Wednesday, March 17th, please signify by saying aye.
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 All those opposed, nay. Motion prevails. Thank you, Representative Marquardt.
Thank you.
Members, today in committee we'll be hearing and laying over two bills for possible inclusion. House File 1083 from Representative Moller and House File 1422 from Representative Mariani. Because we are laying them over, we will not be taking any formal motions today. Representative Zhang, would you like to make a motion to move House File 1083 before the committee and to lay it over for possible further consideration and possible inclusion in a future omnibus bill?
So moved for possible inclusion, Chair.
Thank you, Representative Zhang. Members of the committee and members of the public, we're looking to lay this bill over by 10:55 a.m. Representative Moller, welcome to the committee. Please state your name for the record and proceed with introducing your bill.
Thank you, Chair Dabney. I'm really happy to present House File 1083 before the members of the committee today. Members, House File 1083 creates a lead position at MDE to assist school districts in assessing their response to student mental health and to develop evidence-based practices. As somebody who lost a teenage family friend to suicide in 2017, I began to realize that student mental health was in a state of crisis. And even before the pandemic, every educator I talked to said students were experiencing growing mental health needs and that those needs were not being met. Students have also been telling us that this is a big problem. In 2020, suicide was the second leading cause of death for young people. The 2019 student survey indicated a growing number of students who felt depressed and anxious, and an alarming rate of students who had seriously contemplated suicide. And this was all before the pandemic. In 2019, I had the opportunity to attend a National Conference of State Legislators suicide prevention convening. And I learned there that many other states had a better response to student mental health, including a position similar to the one that we are creating in this bill. The Comprehensive Student Mental Health Services Lead will be able to assist school districts by assessing the quality of their school mental health systems, collecting local, state, and national mental health resources and providing that information to schools, sharing evidence-based strategies with districts, along with other information about available grants, training for teachers and staff, and mental health curricula for students. This bill has bipartisan support, and it has been improved in the interim with the assistance of MDE, who I want to thank for their help, and they're available today for questions. In addition, this has the strong support of NAMI, and Sue Abderholden is also available for questions. The Minnesota School Counselors Association, Education Minnesota, Ed Allies, the American Foundation for Suicide Prevention, the Coalition for Children with Disabilities, and others have all indicated their support. There are several letters of support in your packets. A fiscal note has also been prepared in relation to this position, and Mr. Chair, Amy Jones is my only testifier today.
Thank you, Representative Moller. Ms. Jones, welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you. Good afternoon, Chair Dabney and members of the committee. My name's Amy Jones. Thank you for having me today. I am an educational consultant working on improving mental health for students and school staff in Minnesota schools. I am an appointed member of the State Advisory on Mental Health and the Mental Health in Schools Work Group. I am also a licensed teacher and have worked in Minnesota public education for over 28 years. In addition, I served 2 terms on the Mounds View School Board and spent much of my tenure advocating for improved mental health in our district. Representative Moller and I have been working to provide more mental health support in Minnesota schools after seeing a growing and timely need. House File 1083 would put Minnesota in line with other states that have a mental health in schools lead or director in the Department of Education. We are one of only 6 states as of the last legislative session that did not have such a position in their state's Department of Ed. This position would not be tied to overseeing a grant. Rather, it would provide a much needed contact person to address the many challenges and opportunities currently facing our school staff and students' mental health. Daily, I hear from students, teachers, principals, superintendents, and school board members. They are all telling me the same story. They know that students and teachers are struggling with deteriorating and pervasive mental health challenges, and they don't know who to contact at MDE. These challenges make teaching and learning much more difficult. The Comprehensive School Mental Health Services Lead position at MDE would serve as a source of information and support for all of our stakeholders. They could identify and scale up some of the innovative practices that already exist in our districts. As a state, we can do better for all of our students and school staff to help support and address improved mental health in schools. This MDE position would connect mental health expertise with the teaching and learning expertise. This position could help teachers as we hopefully move toward requiring mental health education, as well as disseminating information, training, and resources to address the most common mental health and school challenges, which are anxiety and depression. There are specific instructional practices that we can implement that could benefit all students. This information needs to be shared widely. This position is long overdue, and if the pandemic has shown us anything, it has illuminated this glaring and growing need to improve mental health in our schools. Our students and school staff deserve the support. I thank you for your time, and I hope for your support.
Thank you, Ms. Jones. Questions from members? Please note that Representative Kresha is excused for today. Representative Erickson.
Thank you, Mr. Chair. Is the department available?
Mr. Uni is here. Representative Erickson.
Thank you, Mr. Chair. My question is for the department. So we know that mental health issues have been growing over the years. So explain to us, Mr. Uni, what has MDE been doing to assist districts before you brought forth this idea of having a lead? I mean, have they not been interacting with districts? Explain this to the committee so we understand more fully what the department has been doing and what more they will do if they have this position.
Mr. Uni, please state your name for the record and then proceed with your testimony.
Mr. Chair, committee members, my name is Adosh Uni. I'm the Director of Government Relations at the Department of Education, and Representative Erickson, thanks for the question. So we did provide technical assistance on this bill for the Representative Mueller, and while this isn't part of the governor's budget, this does provide this proposal would provide us with resources to provide more of a comprehensive, directed approach towards comprehensive mental health services. But to your question about what we're currently doing, Right now, we have resources spread across several divisions that we use to assist our school districts, our educators, and our students around mental health services. Our special education division provides health services through our implementation work under IDEA, as well as the work that we do under our multi-tiered systems of support work, specifically with our positive behavioral intervention support systems and the professional development that we do around that, as well as implementation work on the district level. Our Equity and Opportunity Division administers federal Title IV program, Part A, that allows schools to use federal funds for school mental health programs. And then our Division of School Support, which has provided a lot of the assistance and technical assistance on this bill. And the School Climate Center, as we know, that was passed back in 2014 with the great help of Chair Dabney, has received 2 federal grants that address some of the aspects of comprehensive mental health systems. And the 2 federal grants are the School Climate Transformation Grant from the U.S. Department of Education and Project Aware, which is advancing wellness and resiliency in education, and the State Education Agency grant from the Substance Abuse and Mental Health Services Administration. And then we've done a lot of work through the School Climate Center in terms of providing our model plan for anti-bullying, as well as providing assistance to best practices implementation for districts. And a lot of our anti-bullying work does have a mental health component to it.
Representative Erickson.
Thank you, Mr. Chair, and thank you, Mr. Oni. So how about the regional centers of excellence? How have they been engaged in helping our schools and our charters?
Mr. Rooney.
Mr. Chair, Representative Erickson, I don't actually have the exact information on what the regional centers have been doing in this space on an ongoing basis. I know that they do a lot of work around core academic subjects in terms of implementation work for our members, but I know that a lot of their staff stand ready to be able to help implement best practices. I just don't have any examples on hand of the work that they've been doing.
Representative Erickson.
Thank you, Mr. Chair. One last question, Mr. Oni. So what do you envision at the department with this lead? Is this going to be an official office area, a cubicle, or, how do you envision this? And I looked at the fiscal note, so I'm not sure if that's going to cover staff in addition to the salary of the lead, but explain to us how we can expect this to look different from what's going on now.
Mr. Rooney.
Yeah, Mr. Chair, Representative Erickson, that's a great question. So as I had mentioned, currently we have some services that some of our staff members through our federal grants and through some of our other efforts are able to offer in the space. So it's spread across several divisions, and it's not as coordinated as this position would be. So this position, yes, would be 1 FTE. In the world we live in now, I'm not sure if it would be virtual cubicle. I imagine they would have a workspace at the department, but one of the areas that they would be engaged in is conducting train the trainer aspects, right? They really want to get out, provide the best practices to our educators and to our school system. So they would be traveling around as well, providing that implementation assistance, but it would be 1 individual. I think that this individual would probably live, and I can't guarantee it, I think it would be up to the department, but in the Division of School Support that currently hosts the School Climate Center, they have some supervisors and assistant directors that have a lot of experience and research in this area. So they would be providing pretty good resources and supervision for this work.
Representative Erickson.
Thank you, Mr. Chair. So, Mr. Oni, I hope there will be a report on this, to us if this becomes part of the education code. Because members, we enact these staff additions or we enact policy, but we don't do the implementation. So it's really important that we know from the department and from all the resources to which they might refer what the evidence is that we're doing a better job with our children as they experience these growing needs in mental health. So thank you, Mr. Chair, and thank you, Mr. Oni.
Thank you, Representative Erickson. Representative Sandstein.
Thank you, Mr. Chair. And maybe just to kind of follow up on the question from Representative Erickson in an indirect way, or maybe a little more indirect way. I know the department, consulted and worked with the legislature in the last session when we required ongoing professional development and a suicide prevention for our students. So I think that this is a natural position to have, especially born out of concern for the increase in mental health issues that districts are seeing and students are dealing with. So I appreciate this work very much, and maybe Mr. Uni has something to comment on that, but it wasn't that long ago that we put that safeguard into place and that requirement for teachers and that training in place to help with this issue. So thank you very much.
Mr. Uni, any response?
No, Mr. Chair.
Thank you. Representative Youakim.
I just want to thank Representative Moller for bringing forward this bill. This is exactly what we need to be doing up here, working with stakeholders, seeing a need and filling a hole. And I think it is really important to have this position at MDE to tie up all those loose ends. Mr. Uni did a really good job explaining about all the different things MDE is doing, but I kind of look at it as a scattered loose ends all over, and they're tying it into one big knot with this position to coordinate and make sure that resources are there for school districts when they have questions. They have that one person to go to connect them to the resources that are out there, but also to coordinate the programming and to coordinate the trainers. And frankly, one position doesn't seem to be enough for all that's going on, but it's a really good start. So thank you.
Thank you, Representative Youakim. Representative Bennett, our last member question.
Thank you, Mr. Chair. And the question for Mr. Uni, sorry to pick on you so much, Mr. Uni. Just wondering, we need to obviously react to this great increase in mental health issues in our schools and in kids in general. Wondering if the Department of Education, or perhaps it's the Department of Health, and you maybe wouldn't know the answer to it in that case, but who is delving into what's causing this? Obviously, with this great increase, something or things are driving this in our kids. Has that been looked at so that we can kind of get to the source of the problem?
Representative Bennett, an excellent question. Mr. Uni, what is the cause of student mental health challenges?
Mr. Chair, Representative Bennett, yeah, that is a good question. I do laugh because it is well above my pay grade, not because it's not a great question. I think that is one of the reasons why resources in this area, whether it be the comprehensive mental health services position, the health services position we have in our bill, or a range of other proposals that would provide us the resources to continue to look at this and collaborate with our other agencies. I think you pointed out that the Department of Health and probably the Department of Human Services also have a lot of expertise in this area. I'm fairly certain, I just haven't done the research before in terms of who's been doing the work in this area in our agencies, but I do know that there is collaboration. There are experts at our division working with academics, experts nationally at the state, looking at these on a daily basis. But I don't have the work in front of me to provide that, but I'm sure we could have a whole week of hearings on that. Just on that issue alone.
Thank you, Mr. Rooney. And Representative Bennett, I think a week's worth of hearings is more than we can bite off at this point in the session, but I think your concern is spot on, and Mr. Rooney's pointing to the complexity of it is also right on. Representative Moller, I see you have your hand raised, and I'm not sure whether it's to respond to this question or you're anticipating your closing statement, but either way, balls to you, ma'am.
Yeah, thank you, Mr. Chair. And I just wanted to note that Sue Abderholden from NAMI is on the call. And I think Representative Bennett's question was excellent. And I wondered if Ms. Abderholden would be able to speak a little bit more to her question.
Certainly. Ms. Abderholden, please state your name for the record and then proceed.
Thank you, Mr. Chairman. Members, Sue Abderholden, Executive Director of NAMI, Minnesota. There isn't an easy answer to that question. It's kind of like a whole slew of things that are impacting young people these days. Some of it is certainly social media and kind of the negative aspects of that. Bullying certainly plays a role. Having access to lethal means certainly plays a role. And I think just sometimes the young people are impulsive, and so sometimes it's kind of hard to predict. And so we want to make sure that we're intervening in that way too. But I do think we have to remember, when many of us were young, if we were getting bullied or we felt out of place at school, we would go home and close the door, and we had a chance to heal overnight, to be honest. You don't get to do that anymore with social media. It's constant. And so kind of having, questioning yourself and your ability to do things and how you fit into the world, all of that just frankly makes it really more difficult for young people today.
Ms. Abderholden, one of the striking statistics that came out late last week from the Department of Health was a welcomed 15% decrease, 16% perhaps, decrease in suicide amongst young people, teenagers to, I think, some young adult. I forget the exact age threshold that they cut off at, but very welcome and a little bit counterintuitive, because we've been having a lot of conversations through this pandemic about the mental health demands on particularly young people disconnected from traditional in-person schooling. Can you, I don't know if it's speculate, but can you respond and maybe help us better understand that data?
Absolutely, Mr. Chairman. So think about it as kind of two different groups of kids, right? So you have a group of kids that were functioning fine before the pandemic and then became isolated and are struggling with that. And then you have the kids who were struggling before the pandemic, not having to go into the building, be bullied, feel out of place, kids who are struggling with social isolation. It's actually been easier for some of those kids to be at home. So I know that seems kind of odd, but you've got kids who were struggling before who felt safer at home. And then you've got kids who actually, really wanted to be in the school and felt great there, who are struggling by not being there. I do want to note that the suicide rate went up for the 18 to 26-year-olds. And so they seem to be struggling, frankly, more during the pandemic.
Okay, thank you for correcting that. I hadn't picked up that where the age cutoff was that they were looking at. So thank you for that. Representative Moller, I know this has been a passion. You and I met, I think the first time you and I ever met was you came into my office to talk about this issue. And I believe with Ms. Jones, if I remember, I'm hoping I'm remembering correctly. So I appreciate your bringing your passion as well as the concerns of your community, because I know that your community is very concerned about this. Any closing statements on your bill?
Thank you, Mr. Chair. And I just want to thank you for hearing this bill today, and to the members of the committee for your really excellent questions and the discussion here. I also just want to give out the National Suicide Prevention Lifeline, 1-800-273-8255, or text MN to 741-741. I think it's important whenever we're talking about suicide to make sure people know that help is available. And with that, members, I know this is being laid over, but I hope that you will support this if it comes before you in an omnibus bill. Thank you.
Thank you very much. And with that, Representative Zhang renews his motion that House File 1083 be laid over for possible inclusion in a future bill. Next up, members, Representative Mariani is busy in another committee at this point, so we're going to recess for a few minutes. Ms. Burt, it's 10:55, so we're right on time. 10-minute recess? I'm looking for some guidance here.
Sure, 5 or 10 minutes would work.
Well, let's start with 5 and check back in at 11. But in the meantime, members, it's time for another cup of coffee for the day. Thank you. We are in recess.